All right, you're good.
All right, gang. Well, it is, like I say every week, it's always a good day when it is a red carpet day. So we're going to kind of have some fun today. We're going to learn quite a bit. I've been here a little bit this morning. I can tell you I've had a lot of fun with Todd. So you guys are in for a treat. He's a great guy. Um, Todd is originally from Fort Collins. He was born at Poudre Valley Hospital. He lived in Fort Collins from birth until a little bit over 30. He then moved away to Washington State, back to Loveland, Colorado, and then about 3.5 years ago, he finally came home to Fort Collins. Todd has a wonderful wife named Jen, which you are going to meet today. She is going to talk a little bit. Jen's actually lived all over Colorado. She's a little bit more diverse in where she's lived than Todd. She's been originally from Yuma, Colorado, then to Leadville, made her way to Fort Collins, and a few places in between. They have 4 kiddos, all ages between 9 and 15, 3 girls and 1 boy. They're all very outgoing, very unique in their own right. He could spend all day talking about them. So big happy family. So good stuff there. Asked Todd how he kind of got started in this field, kind of in this idea. And he kind of answered back, I have some experience managing an office for my father's audiology practice. Ideology, there we go. See, good thing here, sir. Audiology. See, well, I need a speech therapist because I can't say it. He was working there when he was going through college. He was main reason for him taking the office in business management was to keep costs down when his wife started her practice. And like I said, we're gonna get to know Jen a little bit as well. He wanted to expand some of his skills that have kind of been left dormant while he was raising his kiddos as the main stay-at-home parent for the last 12 years. So he kind of re-entered into this working world, helped his wife start her practice, and he's been here ever since. So we're glad to have him. Some of Todd's favorite hobbies are Todd and his family are active members of the Presbyterian Church, where him and his wife have many responsibilities. I found out that he's the treasurer of that church today. It tends to keep him pretty busy. Todd has always liked old cars, and he is a member of the Hudson Exis Terraplane Club. His interest in Hudson cars started from his grandfather, who never got rid of a car or a tractor that he owned. His grandpa had a 1953 Hudson Hornet sedan that Todd still has to this day. So pretty cool car. You'll have to send everybody pictures. When Todd is not volunteering for his church or talking cars or working on his cars, he's watching movies and riding his bike with his family. Something not a lot of people know about Todd, but should, is he loves bright, colorful socks. Can't see his socks, but I vouch for it. They're pretty cool socks. I asked Todd kind of a silly question, as I always do with our red carpet folks. I asked him if he would rather have a hairless tail that he could hang upside down from, or feet like a chimpanzee so he could climb up a tree, and asked him why. Todd said, I'd rather have a hairless tail. It would bother me to pick stuff up with my feet. It's a long-standing bias. I don't know what that bias is, but why don't you take him out to coffee and he'll tell you. All right, everybody, please help me give Todd a warm red carpet welcome.
Hello, everybody. I'm going to remove my mask for a minute so that people can see me talk. I'm going to ask a rhetorical question first. Who knows their doctor personally? Who can send a text message to their doctor and get a reply that same day? That is what we do here. We want to meet you where you are. We want to encourage a personal relationship with your doctor. That's what my wife, Jen Lentz, does, and that's what Dr. Magruder does. They both are extremely passionate about developing a one-on-one relationship with their patients and having that interaction that is both secure and well thought out. We don't have 5 to 10 minute windows to talk with your doctor. We have 30-minute to an hour-long windows. And I can vouch for sometimes those, because they get so excited to talk about your health, sometimes those windows go a little bit longer. We are a membership style practice. What that means is you pay a small monthly amount, and you get all the care that we can provide. No co-pays, no office visit fees, no facility fees that show up in your mailbox 3 months later and you don't know why. We don't send bills to insurance. We take all insurance except for Medicaid. And Dr. Magruder also does not take Medicare. And that's because of the way those programs work. So it's not our choice, it's the state of Colorado and sometimes the federal government that dictates that. We try and be very transparent in all of our healthcare costs. What that means is if you need a prescription, we can provide it if you're a member for wholesale cost plus 10%. If you need a lab done, we can do that at cost plus 10%. What does that look like for a lab? We recently had a patient that was away from the office in another state. We told her that we could order the labs to a facility in that other state, but we would not be able to guarantee the price because we are out of state. So we can make the order, but we can't then guarantee the price out of state. So for a lab panel that we ordered, the cost to the patient, if they were here in state and got it through our office, would have been $12. The facility that she went to and got the lab done at, her final cost was $264 and change. So that's just giving you one example of a very simple lab test that we can do here and save you 4 months worth of fees for our practice. The final point I want to make is, if you need imaging done, MRI, CAT scan, x-rays, we know how to navigate that system so that you can get the best cash price for those and move forward knowing that you're getting the best possible price. So with that, I'm gonna turn the floor over to my wife, Dr. Jennifer Lentz, and Dr. Joy Magruder, and we will also hopefully have time to introduce Katie, our nurse.
Okay. Lady. Figure out the unmute button. Hi, I'm Jen Lentz. I'm Joy Magruder. And we're the physicians at this practice. And as Todd said, we pride ourselves on relationships, but also full spectrum family medicine. So we can see your babies, we can see your parents, we can see everybody in between. We do procedures here, we do women's care here, we do EKGs, we do lung function tests, we do labs, all kinds of urgent care. Chronic disease management is a specialty, and honestly, we treat it a little different because, as you know, going to clinics, they don't have a lot of time, most clinics, they don't have a lot of time to talk to you, and so you have a problem, they often just throw another medication at you, and we work really hard to figure out a way to get you off medicines, not add more. So we like to practice in that way. Okay.
Oh, and just the chronic management, the beautiful part and why I love our practice is that, and we got to talk about it in our small group, is that the time we get to spend with patients. Medicine has changed. I've been in medicine 20 years. Medicine has changed over the last 20 years and then some. And it was eroding that relationship, and in direct primary care, we are able to reestablish that relationship, and that makes for a wonderful patient-doctor relationship, and it allows patients to go away feeling like, hey, I'm heard, I'm cared for, and I got a plan to get me better.
And I have a slide I want to show you. But it's not that one. Hold on. This is just an example, and I don't know if you can see all of that, but this is the actual savings. And this is a patient who has insurance and was using his insurance with his previous doctor who sees me. And at his first visit, I was able to change him over to a ketogenic diet, remove some medications, And as you can see, he saves over $1,300 per month on his medications because he sees us. Just based on how cheaply we could get certain medications for him and which ones we could change. And so I think this is also a very important part of what we do, because we give very good, excellent care with the time that you need to form a relationship. We also look for the costs of medicine that we can reduce, because medicine is too expensive. Medicine has gone out of control. So this is just another way that we can really help if you sign up with a practice such as ours.
Well, an example of a patient that actually, because people wonder about, well, if I have insurance, should I come to you? She is actually, by the savings, she has some chronic disease, has to have mandatory labs required labs based on meds every 3 months. And the cost that we're able to save her on her labs with her insurance now, using our prices, she now pays for her entire year membership to be part of the practice just by lab savings alone.
And then one last thing I want to add is that I'm also certified in obesity medicine, which I hate to call it that because it's truly chronic disease medicine, and it all kind of stems from the diet we eat. And so I work really hard to educate myself on fasting, low carb, keto, plant-based keto, any kind of essentially get the crap out of your diet kind of diet, to get you off of meds, to make you as healthy as possible, to promote your health, not treat your diseases. And so I just wanted to throw that in as well. Todd trying to unmute. Todd, do you have anything you want to say? And there you go.
I'm sorry, I was trying to put up our address, our website address. One thing that we can do for employers, if you have 5, 10, 15, 25 employees that you're looking to add a healthcare benefit, but you're looking at the cost of adding a healthcare benefit, and it's in the thousands of dollars per employee per month. We would be a way to offer something that isn't insurance. So we don't claim that we are insurance. We encourage people to have insurance of some kind to stop people going bankrupt from a healthcare cost, which is why we should all have health insurance. But for employees, you get healthier employees because we're looking at the whole patient, as we've already described. You have fewer lost employee hours because when you have an appointment with us, we honor that time. And if you have a 10:30 appointment and it's for 30 minutes, we are ready at 10:30 almost always. And the appointment will be done by 11, if not sooner sometimes, if it's just a quick checkup. So knowing that you don't have to go into a waiting room and wait for an hour and then get taken back to a room and wait for 30 minutes to 45 minutes and then see the doctor for 3 minutes and then get kicked out. We don't do that. So we really honor the patient's time, and that helps employees know that when their employee goes to the doctor, it's not an afternoon lost. We also provide the ability to add that low-cost health benefit to the employee, and that helps with retention. So you have something that doesn't cost the employer very much, but you gain so much in goodwill from your employees signing up with this. The last thing I would like to do before we start taking questions is go over what we are going to do for our red carpet special. So through the month of September, so this ends at the last day of September, we are looking to expand Dr. Joy Magruder's practice. And so for one individual for 3 months is going to be $200. If you add a spouse, that would be $150. So the total for 2 people for 3 months would be $350 total cost. If you need prescriptions, if you need labs, those would be extra, just so you're aware. But we will make sure that you save money on those items as best as we can. Our prices, if you are between 21 and 64, it is $60 per month. 65 and above, it is $80 per month. If you are 0 to 20 years old and you have a parent or guardian sign up, it is $15 per month. If you just want to find healthcare for your child and don't want to sign up yourself because you have other means, it is $30 a month for that individual child to sign up. So we do try and make it as aggressively priced as possible. We do try and make sure that you have a nice regular expense that you can pick going forward.
And last, we have Katie here, and Katie is our wonderful nurse, and she does blood draws. The challenging of homeschooling has decreased our blood draw days to just 2 days a week right now, as she is teaching her kids too. But she does them here in the office. We don't have to send people out. So you can come in for your appointment and you can see Katie. She can give you your shots or draw your blood or does all kinds of other things. And if you call, you're often going to speak with Katie. And so I can't see Katie because she's in a different picture. But Katie, do you want to say hi?
Hi guys. Yeah, I'm behind the scenes in a lot of things, but one of my favorite things to do is draw blood. I like to do whatever I can to help make the visits easier and more friendly. Love getting to know all of our patients and doing whatever I can to support their needs. I also like to help out with filling prescriptions and refills, answering any questions that I can, and just, yeah, being there to help.
All right, Todd, it looks like we have some questions. Are we ready for Q&A?
Yeah,
Okay.
I'm ready. I would love that.
Okay, let me make you the spotlight video again and I'll open up the chat questions.
And I can see them on my screen. So,
Okay.
I saw that Seth, you asked, so do you not take Medicaid or Medicare? We cannot, in the state of Colorado, contract with a Medicaid patient. The state of Colorado has a special carve out to limit our abilities to do that. And so we do our best to not take. Go ahead, Jen.
I just also wanted to say earlier, Todd said we take insurances or used the word we don't take. We don't use insurance. Insurance does not come into this whatsoever. If you have insurance, we can refer you to where it can be used for procedures, for studies and things such as that. But insurance essentially stays out of the picture. We don't let them get in between you and your care and us. And so as far as the Medicare and the Medicaid, I can see Medicare patients and we can contract with them because I have opted out of Medicare. I can still order your tests and they will be paid for. Medicaid, it's against the law for any medical professional to take money from a person who has Medicaid, and it's one of 2 states. So that's just that's a law that we would love to see get rid of, because there are so many Medicaid patients who cannot find physicians or good quality care, and we would be a great option, but at this point we're not able.
Thank you. So Jason asked, do we charge for procedures at all? Generally, no. Sometimes there is a consumable involved with a prescription medication. We would charge for that. But if you just need an injection, no, we don't charge for that. If you need stitches, no, we don't charge for that. Truly, we don't charge for those.
If you get a biopsy, if you get a skin biopsy or a pap smear, the pathologists will charge you, but we have deals. So the pathologist we use for the pap smear, it's $35. That for the biopsy of your skin, we were able to contract with a local pathologist, so it's only $50. So there are those fees, but as far as our procedures, no extra cost, except for, like Todd said, if I do a joint injection and we use a steroid, I charge the $7 to $14 for the steroid like we would any prescription.
And Jen, I would love you to answer, you do COVID tests and how much would that cost?
Yeah, and Katie knows the price a little better, but we do COVID tests. We use 2 different labs. Well, we can use the local ones too. If you have insurance, they pay for them. Our local labs, we do the PCR nose tests, and the ones we use. Katie, can you tell us the prices for those 2, please?
We have one lab that currently is not charging patients who do not have insurance. So their price originally that they told us was, I'm trying to remember off the top of my head, Jen, I don't.
It came down to about 75. That's right, because it's 150, but if you pay cash, they take off 30%, and if you pay within 45 days, they take off another 30%. So it was about $72 to $75 for that test.
And like I said, right now, she told me that under the CARES Act, they are not actually billing patients for the test. And then anybody who does have insurance, we can submit the insurance information with the COVID testing, and the majority of insurance plans are covering for COVID testing. We also have an antibody blood test that we can do, and that for self-pay patients is $45.
Thank you, Katie. The next question is, how often can a patient visit or ask questions for the monthly fee? By Lori Scott. We have not had a patient that has used us so much that we've had to limit visits. So as of this time, we don't limit visits, we don't limit text messages or emails. If someone were here every day for 3 or 4 months, we would need to come to a better understanding on how to use us. But so far, we have some patients that see us 5 times in a month, but they're not having the greatest month right then, and they need help. And then the next month, maybe they only need to come in once, and then the next 3 months, they're actually fine because they got the help they needed when they needed it. So that's a great question. So far, we don't have an issue with that. As far as capping our practice at a particular size for each provider, that is a variable that is just, you have theories on what a cap might look like. And right now we're just looking to grow Dr. Magruder's practice, but Jen has her own ideas on level of commitment to the number of patients, and Dr. Magruder would have her own separate view on what that looks like. You want to handle those questions?
You know what, it's going to be case by case. So essentially, if I get to a number where I feel like I can't take care of people as well as I want to, I would likely cap it there. I'm not taking as many new patients right now unless I'm totally requested, because we are building Dr. Magruder's practice. And I think she probably feels the same, that if she feels that she can't adequately take care of her family and take care of every patient like she wants to, that's where she would cap. So I don't have a preconceived number, because some patients need a lot of care and some patients don't. So it's going to be how I feel.
So I believe I answered where we're located. We're just west of College Avenue on Harvard. If you know where the Light Center is on College Avenue, that's Harvard. You just turn towards the train tracks and you'll get to us. And then, yes, $200 for 3 months. I don't know if that was a question. How many employees work at Direct Family Care? You see us all on the call. So there is Katie, our nurse, Dr. Magruder, Dr. Lentz, and myself. That's it. That's how we can keep overhead low. Do we supply super bills for insurance? So because we do not send bills to insurance, we do not have to come up with a super bill with all the coding and all the other stuff that falls in line with that. There are instances where we do prior authorizations, but that's a case by case and as infrequent as possible to do it. So the answer is truly no, but there are unique circumstances that might require something like that. Can we set a broken bone or do stitches in your office or x-rays? So yes, we can do stitches. Setting bones and casting, we do not currently do. And so we would refer you to an urgent care, or if it's after hours, we could refer you to a non-emergency room hospital visit. Jen, do you want to say something on that?
We are able to set the bones, but at this time, financially, the casting material is too expensive to keep for the amount of bones we've had to set because it goes bad. And so we haven't been able to get it yet, but as we grow, it may become something we do. We don't do x-rays on site though, but we have a deal where we can get them less expensive and we can see them. So it would be case by case depending on the fracture at that point anyway. But for now, we aren't setting them just because we don't have the equipment.
Dr. Magruder, Romeo asked, how does an emergency work?
Oh, and like Dr. Lenz wrote a little piece on that. So our goal is pretty much anything that you can do in an urgent care, we can do here, you know, with the exception of the bone, but we can do that first step of getting the x-ray, figuring out what's going on, getting it stabilized, and then getting you to the appropriate care. But we help triage because we are available 24/7. Our patients do have our phone number, our cell number, our text, and so they can reach out to us. Hey, I twisted my ankle, or I'm at work, I cut my finger. We're like, well, come on up and we'll take care of that. So our goal is to, again, help decrease cost. If it's something we can take care of in the office, we will do that. And sometimes if that means we have to come in after hours, we can do that too. So we help triage. If it's in the middle of the night and you're having chest pain, but you're like, I don't know, could this be heart? We want you to call us because we want to help figure out, is it heart, and should you, and direct you to the appropriate care, or no, I don't think it's that. Let's try this and we'll see you at 8 a.m. in the morning.
But our goal is to keep you out of the emergency room. So if you have belly pain, we can get the CT scan, we can get the blood work, we can find out if that's your gallbladder, you know, passing stones, and we can get you to a surgeon. So we can hopefully keep you out of an ER. We can't do the surgery. But yes, if it's truly an emergency, we will let you know, and we will have you go to the emergency room because there truly are things where you need the care that you can get there.
Thank you. Sylvia asked, what are our current COVID safe cleaning and patient practices? So we do our best to limit interaction between patients in our waiting room. So we ask people to stay in their car and send us a text message when they arrive so that we know they're there and so that we know they're here. And then we clean the rooms, clean frequently touched space surfaces at all times. I go through every morning, and every time someone touches a surface, I'm trying to clean it as best I can and as frequently as I can. We all wear masks when we're in rooms with patients. I wear a mask sitting at the front desk just as a matter of habit. We're required to do that, so that's not a big surprise. But really, we go through and try and clean surfaces at all times. We have couches that we'll clean since Nick is relaxing right now. I'm going to wipe that down once he leaves. But we try and do all that. If we see someone who we're testing for COVID, we do that in their vehicle outside of the practice. We do not bring them in. We can do that in the car. We wear masks, face shield, gowns. I mean, we go through every safety precaution, gloves, every safety precaution we possibly can to make sure that we limit our exposure, and that will translate to limiting everyone else's exposure. So yes, if you have a staff of 5, yes, the pricing would be the same for everyone. Because we are trying to be cost conscious on the front end, we get asked this question quite a bit. You know, what if I bring 20 people? Well, it would still cost $60 per month per individual. The reason for that is we've already discounted it on the front end as much as we're going to. Same with for families, $15 per month for a child is extremely reasonable, and I don't feel like we need to discount it more than that. That's as cheap as we can possibly make it, and we aren't going to further discount ourselves except for running small specials like this.
Todd, Lindy asked, do patients see both of you or depending on who's available?
So you sign up, when you sign up for the practice, you're signing up for Dr. Magruder or Dr. Lentz. The distinctions are unique to each doctor. So Dr. Magruder is extremely detail oriented, and we're looking to grow her practice, and you would get all the benefits, the same benefits you get from here. If Dr. Magruder is on vacation or away from the office and there is something urgent that comes up, yes, Dr. Lentz would then see you. Same is the reverse. If you sign up with Dr. Lentz and she is away, then Dr. Magruder would see you. But the way this works is you sign up for an individual doctor and they will follow your care as best as possible. And that's really what you want. You want one doctor that can coordinate all of your care. Dr. Magruder, did you want to talk on that at all?
I just wanted to say that actually, you know, we're a very small group and we're very much a team. Nothing goes unnoticed. If there's a message that comes in, somebody's addressing it, and it's not, oh, that's your patient, I'm not looking at it. That's not how we work. We are 4 people. We, you know, our patients are, and their care is our goal, and most important. And so it is a team, and we cover each other, we help each other out. And that's again, a benefit of being in this practice.
We do try to care for each other. We do know that we each need some time off. So we definitely try to cover and make sure that time off is time off and that we're not always busy and always having things to think about. Because sometimes we just need to not think too.
And that goes for all of us, huh?
Absolutely.
Todd, one more question. Are you locked into a year contract or how does the pricing work?
So we prefer that people sign up for 3 months. That's our requirement, because if you sign up for 1 month and then leave, you're not really signing up for us. You want one visit, and that's not the way this practice works. We are not trying to be the right fit for every single person out there. That's okay. What we're looking for is people who want to have contact when something comes up, not be put off 3 months for an appointment or a physical that might actually be important during the next month or 2. We can't always guarantee that we would have same-day physical appointments, but we try and keep space open for same-day urgent needs. And that goes for anyone who is a member. It's really, we want to dedicate the care that you receive. And if you're a member and stay a member for an extended period of time, we can really do that very effectively. If we go back to fee for service, which is 1 incident, 1 price, then we would have to have a much larger patient base, and it would look a lot more like what a big box medicine practice looks like, where you only see someone for a few minutes. We look at alternative type medicines as well. I think Dr. Lentz would be the exact person to ask that question.
And Actually, Lindy, can you elaborate at what alternative type medicines you mean? Because, supplements, do you mean using Armour Thyroid or NatureThyroid instead of regular? I mean, can you elaborate?
Yeah, those and like homeopathic stuff, doing the homeopathic for flu instead of a flu shot. Just things, do you guys look at other things that you think might work besides traditional?
So I'll just tell you that my biggest, I teach medical students. So if you come in, you'll often see me with a medical student, and they're all DO students, and we use a lot of manipulation with them. But as far as those things are concerned, the one thing I always try to teach my students is there is no black and white with medicine. And you'll go into certain offices where they will actually tell you that you're a little bit nutty for even thinking that maybe you could do that instead of this medicine. And I don't believe in that at all. I do, of course, have my Western medicine beliefs that I do think flu shots are beneficial, but I don't push them on anybody. And I'm happy to listen and help you find elderberry, and I know a lot of people use that. And I've actually put out my list of things that I've found that can be helpful for preventing COVID that are not, medications. So, we use the quercetin and we use the zinc and the vitamin C. And so, yes, we do look at that. And I always have an open mind for things, so that if you come in and you tell me, hey, this is something that I want to try, well, I'm all for you trying it and letting me know how it goes, because I know that every case of something that works has at least an N of 1 that it's worked for. And I need to see that before I'm going to really truly buy into it. But I'm willing, as long as it's not dangerous, to absolutely let's try things, because I'm big on nutrition. I would much rather have all of you eat whole, real food and not eat the non-food we sell in the store and get you off medications. So, that in itself is an alternative, but it's the way it should be. So yes, and nothing's black and white, like I said. I don't give statins to people unless they've had a heart attack, or unless I see calcifications. If you have a high cholesterol, you know what, cholesterol is important. If you have a high LDL, great, your brain is going to do better. It's what we do to our LDL that makes it worse. And so, if we go in and you have a fully calcified coronary artery, yes, you might get a statin, but I don't push them on anybody just for high cholesterol, ever. I don't like them. I use them for people who absolutely have an indication for secondary prevention. So yes, I am big into learning what's new, and I know that Western medicine is not necessarily the way that we should go with certain things.
Wonderful. All right, guys, we are done for the day. I think you guys are doing the ribbon cutting after we get off Zoom. Is that right? We're going to take a picture. Awesome. So I just want to say thank you to Todd and the doctors for joining us this morning. It's been great to learn all about your company. And I want to give them a red carpet thank you. So everyone, there you
Thank
go.
you. We really enjoyed this. If anyone needs to contact us, please don't hesitate to call. Please don't hesitate to send an email. Email is on the website. Please don't hesitate to reach out to us. We'd be happy to answer anything you have after this. So
Wonderful.
thank you.
Well, thank you guys again. And I hope all of you have a wonderful weekend, and we will, in a long weekend, we have Monday off. Hopefully everyone has Monday off. See you on Tuesday for our red carpet networking. Thank you all. Have a great day.
Thank you.
Bye, everybody. Have a good one.